Hi, my name is Katrina Dory, and today we are going to talk about the importance of communication between veterinarians and their clients. Why is this important? Well, if a veterinarian is going to be successful, they're going to need to have a good relationship with their clients. And to do that, that requires good communication. And this can apply to many different professions. We're just using veterinarians because it is my desired career path. One of the first things that a veterinarian would need to use would be verbal strategies. These are the strategies that involve actually speaking, like what you should say, things like that we learned in class. According to Dr. Laura Garrett, one of the things you can do is to show empathy. If you notice that your client is acting nervous, mentioning that it is a good idea to mention that. According to Dr. Garrett, it makes them feel more comfortable, and lets them know that you care about them and subsequently their animal. Another thing to do is use the right terminology. An example given by Dr. Jessica Gramlich is that instead of using the word treatment, using the word estimate, you should use the word treatment plan when discussing what has to be done with a certain animal. The word estimate, it stirs up images of pricey procedures and huge bills, things that are going to add stress to what is already a stressful situation for the owners of the animal. Word treatment plan focuses more on what needs to be done to help the animal and less on the financial burden that a procedure might impose. That is not to say that you don't at some point need to talk about the bills, but this certainly helps keeping everyone calm. And another form of verbal strategies is to avoid scientific language. As you can see from the picture, the scientist saying, "My research involves high fidelity magnetic intensity records," and the public saying, "Wow, fascinating. That's what they think what you think you sound like." Then it's like, what you actually sound like. Wow, 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 wow. Veterinarians have got to remember that they spent 8 years learning these scientific terms and getting them drilled into their heads. The rest of society, not so much, and they will not know what some of these words mean. And it's your job to make what you're telling them understandable. An example of this: epidemic keratoconjunctivitis. I'm with this scared emoji. That sounds terrifying. If we were in a classroom and I was actually giving a lecture, I would ask everyone in the class to raise their hand if they thought they knew what that meant. And odds are the only ones who would know would likely be people in a medical major. Mm-hmm. In an interview I conducted with my mother, Dr. Rebecca Sparks, an optometrist who practices in the city of Andover, she told me that when she has to talk to someone about their condition, and there's a large word that sounds very scary, her best she tells that it's best to break it down with them. Take one piece of the word at a time and explain that. For example, the keratoconjunctivitis and keratoconjunctivitis refers to the cornea. The conjunctiva refers to the clear lining over the white of the eye, and the itis part refers to inflammation. So essentially, inflammation of the cornea and conjunctiva. This is essentially and it's a highly infectious viral infection, or what we commonly think of as pink eye. Yeah. Who would have thought that something we think about a bunch of kindergartners getting has a very scary scientific name. Another thing veterinarians will need to know how to do is nonverbal strategies. These are the strategies that don't actually involve talking. They're like the way you talk, what your body language is like, how you sound when you talk, things like that. According to the Lakefield Veterinary Group, one good form of a good nonverbal strategy is to align yourself with one's eye level. This makes them feel more comfortable talking to you, and and that makes sense. I mean, you all remember as kids looking up at adults and being scared out of your mind because you knew you were in trouble, and it's kind of a hard on your neck if you're having to look down. This is the most comfortable way to do it. And as a general rule, for the most part, eye contact is generally seen as a respectful thing. Dr. Garrett suggests also studying clients for cues. This means their tone, their facial expression, their posture. It can all tell you things about how that person might be feeling. Like if they seem to be on edge, they seem to be fidgeting a lot, you can tell that they're probably a little nervous about something. And once you know that, you can try to put them at ease and use the verbal strategies and other nonverbal strategies to your advantage to make that person more comfortable. And one thing that just about any profession that has clients will have to deal with is difficult clients. In order to truly understand this, I talked with Dr. Susan Nelson, who works at the Kansas State College of Veterinary Medicine. One of the first things she told me is that it's your best bet is to make them feel heard. They are likely stressed about their job, about their animal, about other things that they're dealing with in life, and they probably just need to feel listened to. Most people are not trying to be difficult. They will be the occasional challenging personality, but for the most part, they're not trying to make your life harder. And making them feel listened to helps to make things easy. And of course, they need to listen to you. And again, they are usually not trying to make things difficult, but one of the things that Dr. Nelson mentioned was that they might be distracted with other things they have to contend to. She gave an example of like a person might be watching two toddlers while while at this vet visit. You might have to ask if there was a better time for this discussion, and maybe one way to get, because sometimes now is just not a good time. Then you could always ask them if they have any questions, and if they do, they're likely to listen to the answers to their questions. And sometimes you just have to be overt about it. There's no way around it, though I'd suggest being very careful about how you handle that. Another thing to remember is that we are all humans. Sometimes things will get heated, and you need to know how to stay calm, because getting into a heated argument with a client is not going to solve anything. In fact, it is most likely going to make things worse. And so trying to stay calm, keep everything calm is the best thing you can do. And if you just cannot stay calm, you need to leave the conversation immediately. You just need to walk away until you can, and come back when you're able to be calm again. And this applies to not just veterinarians, but many other professions as well. Doctors, medical doctors also have to break down scientific words to their patients. A lawyer would need to make their clients feel comfortable handling their case, or else that's not going to end well. And shopkeepers would have to deal with difficult clients. Just about everyone has to deal with a difficult client from time to time. Thank you for listening. Goodbye.
Well, I turned on a stopwatch.
Hold on, I am still.
Sorry.
Yeah.